we did our first hike yesterday in the mountains in the Alps. And I was so happy that he wasn't limping because I thought I would always have a limping dog. Before I give you the info on the hormone replacement therapy, I would like to share the full story of my dog Pax because it really led me to understand and learn what was actually happening, not only with him, but many of my patients and even my previous dog Sky, who lived until he was 16. I realized that he was suffering from the same condition, and his sister Peggy, and all these patients and dogs that I saw in practice. I realized that I could have helped much more if I knew this particular piece of information. And as you know, our dogs come to us to teach us, and Pax was no exception. When he got neutered, I wasn't really feeling 100% right about it, but he was supposed to be certified as a service dog for my sleepwalking. I sleepwalked through glass door when I was in my 20s, and I still sleepwalk. So Pax was trained as a service dog and had to be neutered, so there was no discussion. So when he got neutered, he was pretty fine for a few months, but then he got injured and he started limping on the hind leg and then the front leg. And then every time we did something, whether he went swimming or hiking in the mountains or just ran or play, he would be limping. And it was getting worse and worse until he had a pretty severe hike, especially on the left side, where when he was walking, where I was watching him from the back, I could see that he was uneven. And when people started pointing to him having possibly hip problems or other issues, it was really hard for me to actually watch, and knowing that I was doing all the chiropractics and physical therapy and acupuncture and supplements and healthy nutrition and massage and all that, and nothing really worked. So 3 years into this, I almost thought that forever I will have a lame dog. And I honestly felt like a failure. I felt like I failed my dog. And then I came across studies of Dr. Michelle Kutzler and Dr. Linda Brent and did some more reading about hormone-sparing sterilization and hormone replacement therapy. Initially, I called Dr. Kutzler and I asked her for an interview, whether I could interview her and learn more about her work. And the same with Dr. Linda Brent from Parsimus Foundation. When I finished the interviews and when I really felt like this is it, this is what's happening with Pax, I took about 1 or 2 months to kind of make a decision whether I would put him on hormone replacement therapy or not. Because, the old concept of hormone replacement therapy was suggesting that there can be some problems with dogs, that testosterone is not safe, and that bodybuilders are suffering from all these different issues. However, bodybuilders were taken or are taking much higher doses than physiological doses. I talked to Dr. Brent and she said, Peter, don't worry, it's going to be fine. Her dog Toby actually went through the same issues, injuries, low energy, lameness, all that. And he has been now on hormone replacement therapy for about 3 or 4 years. So I finally took the leap and did what I was told to do. And that was to implant suprelorin, which is an implant that is infused with medication that suppresses the luteinizing hormone that causes the inflammation. And then after that, I started testosterone therapy. As a person who's really curious, I first started the suprelorin on its own. And the first day, the first 24 hours, Pax looked like he ran a marathon. He was sleeping, he was peaceful and calm, but he looked really tired. And then after that, I noticed that the inflammation in his body, in the different areas, that the muscles that were inflamed, started to calm down. And that was really interesting and great. However, because I was not using testosterone for the first month, he started showing some symptoms of hair loss and scratching and itching and so on. And that was actually the side effect of suprelorin, the medication that is in the implant. I started testosterone as soon as I came back to Vancouver. We were traveling, and it was like magic. All the itching stopped, his hair restored, and he was doing really well energetically. He was really happy and just different dog. Before this hormone replacement therapy, I thought I was just having an aging dog that was getting older and a little more sleepy and so on. Well, I was completely wrong, because suddenly I had a dog that was happy and ready to play and so on. However, for one more month, he was still limping. And that was the time when I introduced two more treatments. It was laser therapy by Dr. Lori McCauley. Again, I interviewed her. I learned as much as I could, and I bought a laser machine. I started lasering. Dean, my partner, is a physical therapist as well, so we lasered him together, and he started getting better. And then, in the process of Pax having all these injuries, I also decided to formulate a mobility or joint support for dogs, and that was launched exactly in May 2024, the month that World Small Animal Veterinary Association launched the new suggestion or recommendation that dogs should not be neutered and spayed. So, I think that sometimes things happen for a reason, and they are just so synchronized that I don't think it's coincidence. Anyway, in June 2024, exactly a month and a half after we started hormone replacement therapy, Pax stopped limping. And he hasn't limped since. It's been 5 months now, and he's doing amazing. I'm going to cry, I think. We did our first hike yesterday in the mountains in the Alps. And I was so happy that he wasn't limping, because I thought I would always have a limping dog. And for a person like me, first, I'm a vet, I should be able to help him. And I wasn't for the longest time. And now he's taught me so much that I will be able to help many more dogs. And that's why I decided to record this video and share the information with you. So, going back to Pax, he's doing amazing, and he's been swimming and hiking and all that stuff. But he is saying hi, and wants to tell you that we are here to help you and your dogs now. And it's not just me, it's also Dr. Kutzler and Dr. Linda Brent, and also Dr. Karen Becker and Dr. Ruth Roberts, who's been also very interested in hormone replacement therapy. All of us are trying to make sure that, number one, veterinarians will learn how to do hormone-sparing sterilization. Number two, that people who are responsible dog guardians will not be forced to neuter and spay their dogs. Number three, those dogs who are at risk of, let's say, breeding unwantingly, like rescue dogs and dogs from shelters, would be undergoing hormone-sparing sterilization and would keep the gonads intact. I've had the opportunity to travel between Vancouver and North America and Europe. Canada and the US have the most neuter dogs, but they also have the most reactive dogs. They also have the most dogs that are actually suffering from ligament tears and hypothyroidism and decrease in lifespan. When I started going back to Prague, where I'm originally from, the Czech Republic, I noticed that dogs actually are stronger and they live longer, but they also get along much more. And this is what Dr. Kutzler says, that the luteinizing hormone that elevates after neutering and spaying actually affects the emotional centers of the brain, and we may start seeing fearfulness or aggression and other issues. And this is in contrary to what we used to believe, that neuter dogs are calmer and happier and so on. But honestly, when I go back to Vancouver with Pax, there are so many more dogs who are reactive and aggressive. And when I have friends coming to the Czech Republic and to Prague, and I take Pax to the park, and there are all these unneutered dogs, and they're playing, and there are kids, and everyone is happy, which is really shocking and really enlightening. And I just want you to know that this is real and that it has been scientifically proven, because the receptors to luteinizing hormone are in the brain center and the amygdala, which are controlling the emotions. So Going back to the hormone replacement therapy and just kind of review what I said really quickly and maybe with a little more emotions than I originally expected. So in male dogs, the hormone replacement therapy consists of 2 steps. If you see that your dog is getting injured, if you see that your dog has pretty much any medical condition, chronic medical condition, before you do anything else, before you do allergy testing, before you do special diets, before you do any of that, please ask your veterinarian to measure the luteinizing hormone. We know now that the luteinizing hormone will be elevated, will be extremely elevated. But if your veterinarian wants a proof that this is the case, I think that doing a blood test is actually good medicine, and I would highly recommend it because it's also going to be proof for you. Now, after the test comes back and will show that the luteinizing hormone is elevated, what you want to do is to start hormone replacement therapy. And it consists of 2 steps, as I said before. The first one is the implant of suprelorin, which is a medication made by Verbac. And originally, this medication was actually made to temporarily sterilize male dogs by decreasing the luteinizing hormones. But in neuter dogs or spay dogs, desorelorin can be given to actually reduce the luteinizing hormone levels or stop production and reduce inflammation. So this is a new use, not the original use of the medication. Now, there are 2 different implants. One of them is 6 months and the other one is 12 months. It lasts for 12 months. The 12-month implants are available only in Europe, I believe, or maybe in Australia and New Zealand as well. In Canada, only the 6-month implant is available. And unfortunately, in the United States, and this is something that we need to solve, in the United States, this medication is not approved for dogs. It's the same medication and it's approved only in ferrets and it's not approved in dogs. I hope that as time progresses and Verbac will see that this is a very important medication to help our dogs, they will apply for the permit and the medication will be available in the US. Until then, you may want to ask your veterinarian to order the medication and you signing a waiver that you understand that this is off-label use. Now, some people may be really surprised that I'm suggesting this, but in veterinary medicine, there are many instances where we use off-label medication. Not all the medications that we use in veterinary medicines are tested or approved for dogs. However, we still use them because there is no alternatives. So, first step, implant of suprelorin. I like to give the implant under the skin around the belly button or just about 1 to 2 inches, depending on how big your dog is, on the side of the belly button, under the skin. The needle is quite large, so you will need a veterinarian or veterinary technician to implant it. It is a prescription medication, so again, you won't be able to get it over the counter. The manufacturer recommends the implants to be done on the neck, but I like to have them on the belly in case there's some sort of inflammation or adverse effect, which I haven't seen, and Dr. Brent and Dr. Kutzler hasn't either. But it's possible. So if it's under the skin, around the belly button, then it's easy to feel, and I prefer that. The second step is prescription of testosterone, and I give 0.5 milligrams per kilogram. This means that Pags gets about 14 milligrams of testosterone every week under the skin. Lucky for him, the needle is very tiny. I use insulin syringe, and everyone can learn to administer testosterone. Your veterinarian, your veterinary technician will show you how to do that. Again, we are lucky in Europe because testosterone is not a controlled drug and it can be used. In Canada, the same. Unfortunately, in the US, veterinarians sometimes are a little more hesitant to prescribe testosterone because of the abuse in bodybuilding industry. This is something that you'll have to sort with your veterinarian because it's definitely a justified and very important treatment. You may be asking why we don't use just testosterone without suprelorin. And there's more research needed to be done. However, based on what we know so far, testosterone itself doesn't reduce the luteinizing hormone on its own when it's injected. There is some sort of difference between the hormone that is produced in the body and the hormone that we inject, and the luteinizing hormone doesn't come down as readily. That's why we use Suprelorin to reduce the luteinizing hormone and reduce the inflammation. However, when we do more research, we may find out that certain doses of testosterone may need to be given to suppress the luteinizing hormone without giving the implant of Suprelorin. When it comes to female dogs, I hesitate to say that we have it completely dialed. I feel really comfortable about hormone replacement therapy for male dogs. However, female dogs have a little more complicated cycle. And I've gone as far as talking to, obviously, Dr. Kutzler and Dr. Brent, and I've talked to my colleague and friend, Dr. Karen Becker. And I feel personally that we still need to finely tune the hormone replacement therapy in female dogs. We have been doing hormone replacement therapy in female dogs for another problem, and that's urinary bladder incontinence for years and decades. It is possible that we may need to start there to just use the same protocol that we used to use for female dogs that are incontinent. However, I feel that as time progresses, we may be able to finely tune hormone replacement therapy to kind of mimic the female dog cycle a little more. Giving just estrogens is not exactly how the natural female dog cycle works. So the question is it the best way to go or not? And I think that as we do more research and time progresses, we will know more about female hormone replacement therapy. However, if your female dog is suffering from inflammatory conditions, ligament tears, hypothyroidism, diabetes, organ disease, injuries, ligament tears, I highly recommend measuring luteinizing hormone, and if it's elevated, implanting the Suprelorin implant and doing hormone replacement therapy and monitoring the progress. I know that this may be a lot of information to absorb, and I also understand that some of you may be shocked or even opposed to what I just recorded. But my personal experience with my dog Pax, Dr. Linda Brent's experience with her dog Toby, and Dr. Michelle Kutzler's research suggests that we really need to change. The World Small Animal Veterinary Association already has shown that they're progressive and they understand the impact of neutering and spaying on the health of our dogs. Now we have to create a shift. We have to create a movement to help other dogs and also prevent many, many dogs to be neutered and spayed and suffering the consequences, suffering from health problems that could be prevented. That's about it for today. Thank you so much for listening and watching. I really hope that you will share this video with your friends and those you care about. And please subscribe to my newsletter because I'll be sharing more information not only about hormone replacement therapy, but other conditions and how to treat them naturally without drugs and chemicals. Thank you so much, and give your dog a hug for me. Take care. Bye-bye.